I am the CTO of Instride Health.
And what is Instride Health?
Instride Health is a pediatric anxiety and OCD telehealth clinic. So we treat kids who range in ages from like 7 up to around 24 who suffer from severe anxiety and OCD. It is fully remote and fully virtual. It's a tech-enabled clinical services, so we build our own technology in-house to provide tools for our clinicians and our operations teams, as well as for patients and families. Patients' families enroll with us for 6 to 12 months, and then they graduate. So it's a single episode of care, and it works. Our metrics are really good about patients who show improvements in their symptoms post-graduation.
Is this, these therapists, are we talking about psychiatrists? Like, is there medication involved?
Yeah, it is a care team. So each patient that enrolls, they get a coach, a therapist, and they have the option of a psychiatrist. Some choose to have psychiatry from outside, but we also offer psychiatrists for most of our patients. And that's one of the beautiful things about it is traditionally you'd have to see your therapist and then you have to go talk to your psychiatrist, and they're not communicating. And so for our system, we have a care team approach to providing care for those patients and their families. And so one of the reasons we built our technology is because modern healthcare systems aren't built around that methodology. It's like, here's a visit note and here are the CPT codes, and I saw this and this is what it's documented. But there's no opportunity to be like, and how's the patient doing? If the psychiatrist does prescribe medications, and we don't prescribe all of them, but like a certain range of them, our coach, who then meets with the patient a couple times a week, understands that they're titrating and can monitor the patient and communicate that back to the psychiatrist.
But these clinicians don't work for you directly, I assume.
They
or do they do?
They are yes. Our therapists are W-2 employees. Our coaches are W-2 employees. So we are like expanding insurance networks, and we are fully employing our clinicians here.
How many clinicians are you guys employing at this point?
Yeah, the company itself totals around a little less than 400 people. I think a little more than 200 of which, and I don't have those numbers exactly right, are clinicians. Our clinicians, there's a difference between coaches who are providing clinical care and our licensed clinicians, which are therapists, and then our psychiatrists, which are MDs. But we put them all in the same bucket in terms of that, around 200.
How old's the company?
A little less than 5 years, or 5 years.
5 years, okay. So right as the pandemic hits, which is the age of anxiety, you guys kind of step in and this is I have anxious children. I mean, this feels like a very necessary thing.
I'm not one of the founders, but when Instride was first founded, it was not meant to be virtual. And then the pandemic hit, and it was like, oh, this has to be virtual for this to work. And I think it was a really great move because now we can provide care at just an incredible scale in a way that you couldn't before. And the stigma around virtual has changed. And yes, it's really unfortunate. There's a lot of sick kids out there suffering from anxiety, OCD, and many other things that are all related in that same treatment family.
And I imagine clinicians are focused in major cities, so suddenly this opens it. There are anxious children everywhere, not just in places where there are enough healthcare providers for them.
Yeah, so we open access to people who are in more rural areas, but also we provide very, very high quality of care with wait lists that are much, much shorter. And so, in a more traditional sense, if you were to go to a program that was in person that would provide this, maybe they can see 9 patients at a time. The wait list is 6 months. And so even in high density metropolitan areas, we're still providing a level of care and access to care that was previously unavailable.
All right, so this company starts and you start working on it, and AI, machine learning is not, yes, machine learning is a thing, deep learning is a thing, but AI and OpenAI have not launched yet. Suddenly these technologies come screaming onto the scene about 2 years ago, but really start getting in gear, I would say, the last 6 to 8 months. Yeah. How are they affecting you as a CTO and Instride in general?
Oh, immensely, right? Everything is now around these new tools. I think one of the things that is really interesting for us, I think that we did right for this is, from the beginning, it's data is always really, really important. You want to make sure that whatever tools and systems you're using, you're collecting the data, you're cleaning the data, you're analyzing it, you're able to do something with that data. And with AI, that just becomes even more important and even more compounding factor with what's going on. And so we built our data system very, very early on. On top of it, the proprietary technology that we built, in healthcare, you either go big solution or a bunch of point solutions, and we have a core system that then integrates with all these other point solutions. And so when AI came along, we have the data already, and we had the system that already connected to all the other systems. And so for us, it was, okay, great. We can, as long as we can figure out how to incorporate AI into our core system in a way that is strategic and smart and effective, we can use it in any workflow that makes sense for us. We don't have to provide it blanket access to everything. We can fully control what it's doing and how it's accessing that data. So the big thing for us was just wrapping my head around, like, what can it do? What can't it do? What is hype? What is real? What is not real? How do we approach this scientifically? How do we try this out? How do we pilot, determine this is a fit or not a fit, and then move on from there? And eventually we're getting to the point now where we have real AI infrastructure built in. We have a few agents in production that are like incorporated into our system and doing very specific tasks very effectively.
Like what you're describing in an information environment where there's so much stuff coming out, new tools, Claude's the best this week, Codex actually is where we should be, 4.6, whatever is rolling out. Do you have a framework that you use to kind of say, okay, let's look at this. How am I going to determine if I want to incorporate this? What do you do in those circumstances?
Yeah, it is core technology best practices at the end of the iterative, agile approach. What is the hypothesis? We think that this tool can do X for us. Great. What is the smallest way for us to validate that it can do that? Let's pull a pilot together. Let's pull like a group of people. And I think being a startup, you can grab some people who are also very excited and interested and motivated by this. Tell them this is what we're doing. This is how we're doing it. This is how we're measuring success. You take a survey before, you take a survey after, and then you say like, does this work? So we try this out for a couple different things. So one example is we try to use voice AI for outbound calls to insurance companies because we are value-based care. We have specific contracts. We're not fee for service. We can't just be like this CPT code, give us this amount of money. It's complicated. We have a lot of custom things. And so one of the things we're struggling with is visibility into how much the program is going to cost out of pocket for patients and families. And one of the best things to do is just call the insurance. And when we call the insurance, we have to like go to the specific line, and then we have to go in the Instride number, and then we have to get that information. We're like, AI probably can do this. So we spun up a pilot really quickly. We didn't build it ourselves. We worked with a third party who was also a startup, and we said, let's call these 9 insurance companies and see what we can get. And then after a week, they're like, well, these 4 insurance companies won't work because of X, Y, or Z. I'm like, okay, so we'll do these 3 insurance companies. And then we did them, and then at the end of the day, they're like, well, of the insurance companies that you called, of this data set, only 20% actually returned data that we think is successful. So yes, it does work for these specific use cases, but not really. And we're like, okay, put this down. We can pick it up again in a year when AI is better and everything is different, but right now this is not worth pursuing. Where there are companies that are spinning up around like, oh, we'll just do AI voice everything at this point, where for us, in our specific use cases, it just was not a viable option.
All right, so it basically works out to be that AI is great in a vacuum. For just you, like if the rest of the world didn't exist, if you didn't have to interface with the rest of the world and deal with their legacy product, their protocol, their systems, their AI, sure, it might work. But
that was actually one of the funniest things about this pilot is what worked the most successfully was when there was an AI agent on the other end of the line too. So it was our AI agents talking with their AI agents, because then it was just like two, phone trees just going at each other and coming to a solution. At that point, it's like, why isn't this just an API? Right? Like if we have our system talking with your system, if an API is more effective, it's more consistent, we have a contract here. It was like when we talked with people that didn't know how to interact with it, it was unclear. It was not a very good result at the end of the day, but it was really interesting to see that like, oh, they have an AI phone tree and we're using AI agents, that is consistently the best outcome for this.
Right, so what you're talking about then is like this, we're in this era of translation layer. How do I take this new technology and make it interact with old technology?
Yes.
But ultimately the goal is, well, this needs to talk to this in this way to be most effective. So at some point we're going to need to upgrade everything to interact or build. I think we talked about this, like what is the medium for AI to interact with other systems the most effectively?
Yeah, exactly. Or like this, we're interacting with this old technology, which is also evolving and changing in a way that is like hard to predict because everyone is trying to do all these different things and all these different tools. And then, trying not to forget, like we have technology systems and protocols that have worked and continue to work. And sometimes it's like, well, we can do this with an AI methodology instead. Great, if that works, but also like, is AI the right tool for the job here? In certain cases, absolutely, it's a great tool. In other cases, like, no, a standard REST API is perfect for what we're trying to do. Just because we can use AI doesn't mean it's the right tool for this job.
If we are at the cusp of starting AI's validation phase, that means different things, I imagine, for different companies. For a company like yours, what does validation of AI tools mean?
Yeah, it's complicated because in health, everything is complicated in healthcare, right? And so there's the bottom line. Like, are we seeing the right ROI with these tools when we're applying AI to this process? Does that make us more efficient? Does this get us more revenue? How does it actually change what we're doing or affect how we're getting paid. And then there's the like clinical outcomes. And so we are very lucky. We have fantastic clinical outcomes. It's like one of the things that is like an amazing strength of Instride. And so when we're applying AI to clinical workflows, we want to make sure that one, it is improving outcomes or at least not worsening them. Or making our clinical team more efficient and effective, but that's a more nuanced thing. Like we don't want to ever apply AI to something and have it improve our bottom line, but make our actual outcomes worse. And so validation here is staying very good with our outcomes in a way that makes sense, continuously builds trust with patients and families because we don't want them to be like, we don't want to work with you because you're using AI. We want to use AI in ways that help the situation and not just like, hey, here's more technology at it. And then on the administrative side, we want to make sure that things are moving more smoothly, more effectively, more efficiently. Or like if we can use it to get better, conversion rate and higher number of enrollments, that's also a win.
I mean, you're living in the Valley. Like, are we going to see a lot of crash outs in this validation era from your perspective? Like, some people ain't going to make it.
I mean, that's always true with startups. Absolutely, right? It's hard to say that they're like, if you were to say everyone who's doing AI right now is going to be successful, that's definitely not the case. What I've seen and what I've experienced personally is the people who are closest to the problem, who are looking at ways to apply AI for specific problems to get to specific solutions, are seeing a lot more success because they can iterate faster, they know what that success looks like, versus the more generic, general, we're using AI as a thing, that you really, I mean, this is true for any startup in technology, you need the product market fit, you need the traction, you need customers to acknowledge that this is successful or not. I don't think that's different. I think that there's more of it and people are building faster. And so as much as people have tried and failed before, I think that's going to continue. I don't know if AI is dramatically reshaping that, but I think it's definitely compounding the fundamentals of building technology for a population.
I think the last thing I want to get into, I'm on my own product market journey at the moment, and you mentioned in our initial call that you only hire people based on like they're endemic to these tools. Like if I'm going to hire an engineer at this point, they need to understand the fundamental frameworks, they need to use the tools the most effectively. So trying to understand what the engineer of the software developer of the future looks like is kind of the ball game right now.
Yes.
And so, we also talked about it, like the Series B company are in that wait and see moment because we don't actually know what the future engineer needs to have. So how do we know what to hire for? What is your gut telling you? Like if you had unlimited money and were hiring tomorrow, who are you hiring for?
It's a really good question. So in terms of who I'm hiring for right now, I don't think it's realistic to be like, you have to have X years of experience using these tools, but you have to be able to talk to it with some intelligence. You have to have experience. You can say, oh, I've used it this and it's been successful here. I've used it here, it's been not successful. I don't really want someone who's like, I've never used this tool and I never will. Absolutely not. And I don't want someone who's like, I use it for absolutely everything, it's the best thing ever. Those are not the right ways of going about it. So when I'm looking for someone, I'm looking for someone who's willing to grow and change and adapt with this, because like you said, we don't know what's going to be at the other end of that. And anyone who tells you, either they're getting really lucky or they're lying to you. And so hiring right now is about people who are willing to go through that evolution and journey and keeping an open mind about how to evolve. You have engineers right now with 15, 20 decades of experience, right, who are like, I am now completely new at my job. This is all very much at the beginning again. And you have others who have like decades of experience being like, I'm not touching it. I'm so good at this. This is what I'm doing. You want the person who recognizes that they're starting over from scratch. In terms of the unlimited funds, that's a more complicated question because it honestly depends on what we're trying to do at Instride. We're not a massive company with a massive tech team. And so really, in terms of like who I'd be hiring someone who has some semblance of experience deploying these things in production successfully. And I don't think that's a really big field, but you said unlimited money right now. And so I think that it's not like we need that to be able to do it, but we need it to be able to do it more quickly. Experience helps navigate around pitfalls and not find shortcuts, but avoid things like delays and blockers. And so that's the level of experience that I think would be really beneficial. However, you have a good team who understands how technology works, understands those core principles, you can get to where you need to go. It's just going to take a little bit longer.
Well, part of that is like we're 6 months to a year away from having a large enough core of people that have shipped AI product successfully. Yeah. Plenty of people will have shipped product.
Exactly. Successfully is the really big difference there.
Yeah. I wonder how we start measuring, like that's going to, I not only shipped AI product, it was a successful thing by these metrics. Yeah. It's not the amount of code I produced. It is everything else around it.
What's the difference between shipping an AI product successfully versus just shipping, a standard technology product successfully? Like at the end of the day, the business metrics, what you're doing, shouldn't be different, right? Like maybe the numbers could be bigger, but the general things are like, are you affecting your margin? Are you trying to get more customers? Are you, trying to build something that can do X, Y, or Z? Those capabilities, like that's how you're being measured. I think it's all about the outcomes. It's not so much about like what you did. And I think what we'll see is the people who can deploy AI successfully there are the ones who understand that AI can solve this problem, so we're going to deploy it in this way. I think where the failure is going to come is when people are like, AI is going to solve this problem, even if they don't know it will and are just going at it. And so the metrics of success, I think, are the same, maybe more extreme, maybe like slightly different, but just because it's AI, I don't think should actually fundamentally change what success looks like.
Thank you so much.